Good evening, everyone. This is Dr. S. Asad. You can call me Dr. Shanila Asad. And today I'm here to just, I've got so many requests for that mock regarding the communications. Many candidate has texted me that there's a very common scenario nowadays. It's coming in every examination almost about the safeguarding scenario. So today I thought just to, take some mini mock from the candidates. And it's not that anyone can, it's just a one station. And I would like to take as much candidate if they want to participate, they can come forward and join and, do the practice of this, take the advantage and do the practice for this station. So before I start, let me tell you something regarding the communication for those candidates who recently joined this group, MedPrep Online. And so the communication station has, it's a 9-minute station, 4 minutes outside the station. And once you enter the room, then you will have a total of 9 minutes, right? So your aim should be that when there's a 7 minutes pass, you should summarize that whole scenario, and in the last 2 minutes you should give the summary and all the stuff that is mandatory. So you have to present to the examiner. So before so let's start without wasting the time. Let me see how many candidates are there. Oh, so I've seen so many candidates. Welcome, Dr. Jannat. Okay. And okay. Just wait. So this is just an outline of this, communication station, that a 9-minute station, 4 minute outside the station for reading and preparation. And then when you enter in the room, after that, you will have total 9 minutes, right? So many candidates have this confusion that the 4 minutes is included in that station. No, it's just a, waiting time, and you can just prepare outside the station when you are, waiting for your bell to ring and enter in the room. So let's start. So this is your communication scenario. I've got so many requests from many. Is it visible?
Yes, ma'am.
Okay, great. Just wait. So who's doing this scenario?
Can I go, ma'am, first?
Yes, Dr. Sish, you can. And then
Thank
after
you.
that, the Dr. Shaheen, you can do it because you also text me. And you have exam in
Yeah.
the September, right? So,
Yeah.
so Dr. Sish, you want 3 minutes or 4 minutes?
I would probably just take 2 minutes or so and I'll start.
Sure. Because this is a practice session. We
Yeah.
won't following that rigorously regarding that.
No problem. That's fine. Can I have 2 minutes then just?
Yeah, sure.
Okay, thank you.
So this is till the time Dr. Sish is preparing, let me tell you that this is a very, important scenario. And it for the last, it came in the Singapore, it came in the Pakistan Center. And I've seen so many recalls that this scenario regarding the safeguarding. So that's why, and many candidates has texted me personally that they want to, do the practice of this scenario. So that's why I choose this scenario. And the one scenario, many candidates, if they want to, come forward and do this, that would be beneficial for all of them. And they can see how the other candidate is doing and their practice, the style of the way of communicating. That would be really helpful for each other. Hello.
Yes, ma'am. Do you want to go ahead?
No, no. If you shall we
I'm
start?
fine. Yeah. We can start here.
Okay. Your time starts now, Dr. Serish.
Okay. Hello, good afternoon. My name is Dr. Aziz. I'm one of the children's doctors in the emergency department. You are Amina's mom. Is that right?
Yes, doctor. I'm Amna's mom. That's
Nice
right.
to see you. Nice to see you, mom.
Thank
Are you
thank
happy
you
for
very
me
much.
to call you mom?
Yeah, that's okay, doctor. You can call me
Okay.
Amna.
Okay. Thank you. I understand that Amina has come in today because of a burn. Is that right?
Yes, doctor. She's very naughty, doctor. I just, she runs here and there, and this is the, third time that she came to the ER.
Oh, I understand. I understand that it could be very distressing for you when your child is hurt, but you have done the right thing by bringing her in. Mom, if before we go into further details, would you be happy to tell me about what happened exactly today?
Yes, doctor. What happened? I was preparing some tea, and within a span of some, I just go to the other room, and within a span of the second, she just pull that tablecloth and put all the tea hot tea all over her body. That's why she got this burn, and I'm very much, doctor, concerned about her. Is it serious, doctor?
Oh, I see. That must be very frightening for you.
Yes.
So while we are doing some examinations and checks on her, she seems stable now. So, Mom, would you be able to tell me that what you were doing and when this happened exactly? Where was she and what you were doing exactly?
Doctor, I told you, I prepared the tea and then I put it on the table, and I went to the room, and within a span of a second, I don't know how she ran and pulled the tablecloth, and that cup poured the all hot cup all over the body. This is exactly what happened. So
Oh,
because
I'm
she's
very
very
sorry
naughty,
about.
she's exploring the things. That's why, you know.
Yeah, I understand. She's a very active toddler, and she must be keeping you busy on your toes. Mom had she got any similar accidents before?
Yes, doctor. In the last 3 months back, she was running and she jumped from the sofa and she hurt her, knee. And before that, she also had a fall from the stairs. Because doctor, she's
Okay.
very naughty. She runs here and there, and I'm alone. My husband, it's sometimes in and out because of the job. But it's very
Yeah.
difficult for me, doctor, to.
Yeah, I appreciate it. It's very busy for you with the toddler at home, and especially when she's so active. Thank you for being so honest and open with me. So, Mom, I just wanted to let you know that as a part of our routine care for all children who come with injuries, especially for children who are very young, like your child Amina, we look at the full picture, including any previous visits. So, see, that's why I've asked you questions about previous injuries. So I have noticed that this is Amina's third visit to the emergency department in last 6 months.
Yes,
And
doctor,
each time,
she's very
yeah,
naughty, even though I, try to take lots of care. But as you know, the children of this age are explorer. So because of that,
yeah,
she's having these injuries, doctor.
yeah, I understand. I appreciate how active toddlers can be a hard work. But when we see multiple injuries in a very young child over a very short period of time, it is advisable to look more closely into it. Um,
What do you mean by
yeah.
doctor?
So, I was just trying to explain you that it's our duty of care to make sure that Amina is safe, and I would like to explore it further. So, are there any unmet needs or any risk at
Doctor, do you
how is
think
the home?
Anna is not safe? She's my daughter, doctor. How can you
Yes,
think
so
like that?
yes, we appreciate your concerns, and I'm sure you are a very keen mother. So it's our duty to keep Amina's safety at our priority list, and also your as a parent, your well-being. So this is something we do routinely in all cases, and we just want to support families. And I'm not blaming parents for anything, but it's my duty to look into this further.
So,
Yeah.
doctor, why you people are doing that? You think that because of me this is all happening? I couldn't understand why you people want to involve the team. Like I mean, why you want to look further? I'm taking
Yeah,
care as much as I can.
yeah,
I'm a
I
very
totally understand,
responsible mother,
appreciate.
doctor.
Yeah, I have no doubt in it, Mum. I completely understand your worries. I'm not here to blame anyone. I'm just want to assess Amina properly and involve the appropriate team so that the best care is delivered. So this is not our job. Is not to assess or blame or judge anyone. We just want to make sure Amina is safe and her home environment is safe. So this is a routine procedure. It's hospital safeguarding protocol, so that will involving my child protection team and a social worker to help understand the overall situation.
Child protection team, doctor. It seems scary to me. That means
Yeah.
it seems like I just read that you involve those teams whenever you are have some suspicion that the child is not safe at home. Is that
So yeah, I'll explain you, Mom. Your concerns are very valid, and I truly appreciate that you are a very keen mother and you want to understand the whole situation. So, your social worker or child protection team are not here to do any harm. They are here to support you and your child, and to gather more information and to look at the bigger picture and to put this puzzle right in place to so we can see what's happening and what's going on with the child, just to keep the child safe, which is always our priority. So this will involve looking things in more detail, a full medical history, and any support you need at home. Okay.
so? That's it. Do you mean to say, doctor, it's a routine procedure, right? Any child who comes with such, is that so?
So any child, a young child with like multiple injuries in a short period of time or unusual injuries, we do not expect in a child, like a child who's very young, who is not able to move or pull or roll, unusual injuries which we not expect due to the age of the child, or like in Amna's case, there are multiple different injuries in a very short time. I understand she's an active toddler, but I will need to look further into it just to make sure that we are doing the right thing for Amina.
Okay, doctor. If you say so that it's a part of that your protocol, then it's fine with me. That's fine, doctor.
I really appreciate your help and which will help us solve the matter more accurately, and the help will be available at you promptly.
Okay, doctor. That's fine, doctor.
Okay. So I think do you have any questions, more questions for me? Do you want anything to go
No,
through
doctor,
again
you
or any
explained me
concerns?
very well that, it's just you people are concerned and they will just see that my place is safe for the child. Is that so, doctor?
Yes, that's right. So I think I've got in a lot of details with you today. Would you like? I would like to just quickly recap what we have gone through, so to just check your understanding that you have understood our next steps.
Yeah, sure,
Is that
doctor.
right?
Yeah, sure, doctor.
So while we treat Abhina's burn, I'll make sure that she's comfortable, she's given adequate pain relief, and I will involve my safeguarding team and a social worker that will involve gathering more information and to look at if you need any support at home and make sure Abhina is safe. A strategy meeting may be held, which will require hospital social care participation if it's needed. And if you have any questions or any ways, we're always around to have another chat with you or anything you want us to go again. And I can also hand over trusted leaflets and websites so you can go through the whole thing again in your
Okay.
time.
Thank you, doctor. So, Doctor
Thank you.
Sarish, 9 minutes, 20 seconds. My bad that
Okay.
I didn't,
Sorry.
give the reminder at the 6 minutes. But there's usually bell ring at the
Yeah.
6 minutes, and then you just have to summarize, pack up all these things, and at the end you
Yeah.
just. So, Dr. Sarish, how do you feel?
I thought I because I didn't know the time, so I in my mind I thought I don't have more information, and maybe there's a lot of time left, and I was thinking about more things to say to mom, because I don't think I had more information or something because mother was not asking any active questions, so I was just making things in my head what else I could say. I think it was fine. I felt
No, Dr. Sarish, you have done very well. Your tone was very empathetic, right? And you were showing very much concern. And like more than a mother, you were more concerned. So,
were not, I think, because you were a good mother, because otherwise I've seen that safeguarding mothers, they just attack the doctor, why are you doing this and why social teams and why this and that, so then
you
it
know,
becomes very
when
difficult.
this exactly the same scenario came in my exam, and my role player was very nice. She was just
Okay.
listening, and they were, the way we are practicing during our, practice session, they were very harsh, and sometimes they would say, "Okay, why you are doing this?" And then
Yeah.
when in my exam, the role player was so sweet and come, "Okay, doctor, if you say so, that's fine." So I'm just exactly mirroring that role player. that
Yeah,
she
but sometimes, doctor, sometimes the mother will say that why are you involving social team, because it will remove my child and you want my child to be taken away from me, and then the
This is
whole
how
situation
that we have
escalates. And
practices it. But my role
yeah,
play exactly, what I was saying, she was like, "Okay, doctor, if you say so, it's a part of protocol. That's okay, doctor. But I hope you are not blaming me. Is that so, doctor?" And
yeah,
this is how that exam goes, right? But the
yeah.
overall, your tone was very empathetic. You are not monotonous. You are, acknowledging that is it okay, mother, and this and that, so it's good.
Thank you. Thanks. Your feedback is always welcome. Thank
That's
you.
good. Okay, now Dr. Shaheen, right? Hello, Dr. Shaheen is here? Who else want to come forward? And so many candidate has text me that we want to do this, and now no one is there to.
I can go.
Dr. Fatima?
Yes, ma'am.
Yeah, sure, sure. Dr. Fatma, just you can see the scenario, right?
Uh, no, ma'am, it's the same. It's the previous one.
Just wait. Yeah, it's just a previous same one.
Okay,
You
ma'am.
want, so you want some time?
Yes, ma'am, just 2 minutes.
Okay, yeah, sure. So Just remember, every time I'll change the role player and sometimes role players can be harsh.
Dr. Sid, while she's preparing, can I ask a quick question?
Yeah, sure, sure.
So in scenarios when parents are very distressed and they stand up and start shouting and they don't let you speak, how will you calm the parents? So you will stand obviously and offer water but how is there anything else you would do to calm the parent?
So you can say that, Mrs. Amna, that's really, it's really, and it's very much understandable. I can see that you are, at the moment, you are very depressed. And but let me assure you that we are not blaming here, or we are not judging anyone. It's a part of our routine protocol. We are trained. If any child who come with, with in the past 6 months, she has a recurrent history of falls. So our training are designed in such a way that we have to involve our senior consultant and, the safeguarding team. So let me assure you, Miss, I hope that's clear, Mrs. Amna. So this is how you will, acknowledge her. And you said, okay, let me
Sure.
assure you, Mrs. Amna, that, this is not only for the, if any child have such history, so we
Yeah.
have to go through with, we have to involve, at one point, Dr. Sarish, you have to say that you have to involve your senior consultant as well.
Yeah.
You haven't involved, and at any point you haven't said about your senior consultant.
I said safeguarding consultant, my child protection team on call. So that's what I meant, that safeguarding consultant.
So, okay. So, so this is how you should inform
Okay.
her that you are not being judgmental. Yeah, you are not
Yeah.
blaming anyone. So it's a part of
Okay.
our protocol. It's a part of our training. So any child with such history, we
Okay.
need to make sure that your home is the safest place. There's no
Yeah.
any things that are harmful for the child. We just have to make sure everything is safe.
Okay. Sure.
Okay.
That's fine. Thank you.
Can I make a quick point, please?
Yeah, sure. Who is this?
Dr. Rizwan.
Ji, doctor. Yes.
Actually, the thing is that the name of the child is Amina and the name of the mother is Fatima. I think when we have to go in the exam, we have to be very well versed with the names. We cannot
Exactly.
interchange the names.
Mrs. Fatma, exactly. So this is a very good point you have raised.
Yeah, I
Whenever
noticed that, but that's why I didn't say Amina. I was saying Amina all the time to the daughter, and mom, I didn't say Amina to mom.
in fact, I was, doing this, Mrs. Amna, and that. So there's a tip: whenever you enter in the room, you just have to write down the, child. Just write down the name. And you have the paper, right? And then you write down the moms and just write down the name. So this is very important. Sometimes the examiner do mind that if you interchange the name of the mother and the child. So this is a quick tip that you just, when you are waiting outside the station, you just write down the mom, and in front of mom, write down the name and child in front of that. And when you enter it, the station, so you can easily remember that who's the child, what's the child name and what's the mother's name.
Excuse me, ma'am, can I ask one question, please?
Yeah, sure.
Ma'am, in any case of suspicion or foul play, how would we are able to figure it out that truly child is safe in her or his home or not?
Doctor,
If the parents don't
your
allow
voice
us
is getting
to,
very echoed. Can you please repeat it again?
ma'am, in case of foul play or suspicion, how would we able to figure it out that child is safe in his or her home or not if parents don't allow us to involve the child protection team or social worker?
This is again, sometimes the role players, are very stubborn and they say, no, I don't want to get any of the child protection team involved in this case. I want to take my child back to home. I don't want to have a treatment. But firmly, you have to tell them, look, Mrs. Fatima, I understand that you are very much, anxious or worried. But let me assure you that this is not we have to follow our protocols. This if you go to any hospital, they will do the same.
Okay, ma'am.
We are concerned about the child's safety as you are. So this is the time that we are not blaming anyone. We want that the child is safe, and we want to make sure that at home he's safe. So this is the exactly, if you want to, go to any other hospital, they will do exactly the same. So there's no point of wasting the time and leaving the child. At the moment the child needs treatment, if you are very much concerned, I can arrange a meeting with my senior consultant. So this is how you can, but you have to be, firmly make your point clear that this is a very important and we have to involve. And there's no point of that leaving the hospital if you are if you want to go to another hospital, they will follow the same protocol. So there's no point of leaving this hospital and going to another hospital. Is that clear, sir?
Okay, thank you so much.
Hello, ma'am.
Hello, Dr.
Sorry.
That's
No,
okay.
I'm Dr. Shahin actually, who
Okay,
want to
fine.
participate. But actually, I got a call, ma'am. Yeah,
Okay.
emergency LSCS call. That's
So this is
why.
what
So,
the Fatima is doing. After that, you can do Dr. Shine, right?
no, ma'am. Actually, I can't do because anytime they can call me. I just want to ask you some quick questions if
Yeah,
you
yeah,
can
sure.
allow me.
Sure,
Oh,
sure.
thank you so much. Ma'am, so in this scenario, the scenario which you have given, it is a safeguarding concern. So, like in this scenario, we are not sure that this burn injury is because of the non-accidental injury, isn't it? So
Yes.
when it is clear cut from the scenarios, like it's a non-accidental injury, you have to explain this non-accidental injury to the role player. So in that scenario, do we need to say that we are already we already initiate this safeguarding protocol, or like
No, no.
before
Yeah. Complete your question, Dr. Shine.
or after taking your permission, we are going to involve the safeguarding protocol? That is my first query.
So, Dr. Shine, it's a very good question. The thing is, if you read the scenario carefully,
Hmm.
you can read it that the nursing staff has expressed her concern that this mother has been visiting in the past 6 months. She has visited third time, right? So she has
Hmm.
some concern regarding the safeguarding issue.
Okay.
You just have to clear this to the mother that we have examined the child and we have seen the history that in the past 6 months, this is the third time that you are visiting in the ER. So any child
Hmm.
with such history, we are more concerned and we might include our investigation in the way that we might proceed with a further test and include the safeguarding team just to make sure the child is safe at home. Is it clear, Mrs. Fatima?
Okay.
Right? So this is how you have to clearly, you don't have to say that now you just tell her that this is our protocol. Any child who have so we want to suspect that is this, this happened because of some, the child is exploring but we want to make sure that this is not something, that it's done with the intentionally, or is there anything at home which is not safe for the child. We want to make sure that at home everything is safe.
Okay. And ma'am, what is the strategy meeting? If you can tell
What is
me in
the
detail.
strategy? What,
Strategy meeting. Yeah.
in what sense, Dr. Shine?
Like as Dr. Shahriz, if I'm not wrong, she told that there are regarding some strategy meetings. I also heard about that. but
Strategy
what is
meeting is
exactly
that, you know, we
what
have
they will
to
do?
involve a senior consultant, the safeguarding team and child protection, and they will, visit your home, make sure that everything is safe. You have to explain the mother that why you are doing this, because the child is 2 years of age and past 6 months, she's coming recurrently, third time with the injuries that are seem suspicious to us. And you know,
Mhm.
being a pediatric, being a children's doctor, we are more concerned about the child's safety, and we want every child to be safe as in the home environment as well anywhere he goes. So that's why we want to proceed our this investigation part. Is that so?
Yes. Okay, okay, ma'am. Thank you. And I'm so sorry, ma'am. I couldn't
No,
participate
that's
today.
okay, Dr. Shine. Because you
Thank
text
you.
me, that's why I was asking there is a Dr. Shine is there.
Sorry, ma'am.
No, that's okay. Okay, so Dr. Fatma, are you ready?
Yes.
You know, coming forward and uh, communicate itself is, it's a good thing. It will, make you more confident on the day of the exam. So that's why I'm asking candidates to come forward, do the practice. It's not that this one candidate has done and I can't do the same. It's basically, you can see the way the Dr. Sarish was talking. It's your own way, how you communicate. This is exactly the key. Okay, Dr. Fatma. Now let's start. Let me start with the timer. Wait. You can start, Dr. Fatma. Oh,
So good morning. I'm Dr. Fatima, one of the pediatrician over here. You're Amina's mom, right?
yes, doctor. I'm Fatima.
Okay. I see we share our name. Just
Yes, doctor. You can call me Fatma. Hello. Hello. Can you hear me, Dr. Fatma?
I think we have lost her. She is
no,
not.
actually no.
Yeah.
I'm here. I'm so sorry. My
Okay.
daughter just
Okay,
finished
okay.
now.
That's okay, doctor.
Okay, I'm so sorry.
No,
So
no, that's
I see we share our name. Right? So how do I address you?
you can call me Dr. Fatima. I'm Amna's mom.
Okay. Okay. So exactly what brings you here? I see Amina is admitted with some
Yes,
burn
doctor.
concern.
Doctor, what happened that, my daughter, I just prepared the tea and I put the teacup on the table. With a blink of, I just went to the room, and when I came back, she pulled the tablecloths and spilled all the hot tea over all over her body. And this is where, I'm very much worried, doctor.
I'm
What had
so
happened
sorry,
to
but
my child?
just to keep you at ease, she's doing very well. She's a brave girl, so
Oh,
shouldn't.
thank you, doctor. I hope
So
it's not
she's
that.
totally out of danger.
Oh, that's great, doctor. But I'm
Okay.
very much worried. She's very naughty, doctor.
That I understand a 2-year-old. I have a 2-year-old, so I totally understand how they are and
Okay.
how difficult it can
You
be.
must be,
So
yeah, doctor, you must be familiar how naughty the
yeah,
kids
yeah.
are.
So apart from this, she also got admitted twice, right, in the past 6 months. Can you please tell me what happened during those times?
Yes, doctor, the last time she fell from the stairs, right, and she bumped her head on the floor. Uh, it's because she was running for some ball or something like. And then the other time she was jumping on the sofa, and again she bumped her head on this, the wooden side of the sofa. This is,
Oh, oh no, thank God she didn't face any problem during those times.
yeah, doctor. But being a mother, I got very panic, and
No, I
went to
understand.
the
So,
ER. Yes.
Miss, you must have baby-proofed your house, right? There are so many gadgets these days for on the stairs and in the kitchen. Miss,
No, no, doctor, I don't have such gadgets.
Miss,
What is that, those, doctor?
Miss, I can connect you. I can share you links for those. They are very good. Because every time she get hurts herself, Miss, God forbid something bad happens to her. I hope not any time. But you should look
That's,
online. I can share some links also. No,
oh,
they are
that
very
could
good
be,
for
doctor.
babies.
Oh, that
She's
could be a very smart thing, doctor. Thank you very much.
you should consider if you need means we have a team. They can also help you. They
Yeah.
are very trained in all these areas.
Sure, doctor. If you doctor think that my daughter is fine, can I leave now?
No, actually, there are a few more questions, we need to discuss. So with
Oh,
just few more minutes, I'll take few more minutes, okay? So
Yeah,
as
yeah.
I was telling you about the team that involves my consultants, safeguarding nurse, the social workers, who all are there to help you. They'll help you in all aspects. Means who all are
Why,
there in the
doctor?
house?
Why you want to involve so many team?
No,
I
just to
just a little one.
means does she have any other siblings in the house, or she is alone?
Yeah, I have two more daughters, doctor.
Okay, so they are all there, to help how to take care of the kid. The kid are
No,
safe
they
at
are
home or
they
not.
are also very. One is 4 and other is 3,
Yeah,
doctor.
so
They
the
are all
team
young.
is just there to make sure that the environment, the home environment, the baby proofing and all, they are very, they
No.
are up to mark. So,
Yes, doctor. My home is very safe. I
but still, okay,
I
go
take
ahead,
care of my
sorry.
child. No, doctor. My home is very safe. I take care of my child. All my children are safe at my home. Don't worry,
Uh,
doctor.
I hope, yeah, all remain safe. But then there is a protocol, no, within 6 months, the child had 3 injuries. So we have to make
Doctor,
sure.
you can see now she's just 2 years, and at this age, child usually run here and there. And
Yeah, that I
as
totally
you know, you
understand.
already have a daughter of 2 years, so you must be aware that how
Yeah.
naughty they are at this age.
Yes, that is very difficult. This is a difficult time for mothers.
Doctor.
But
That's why I'm telling you. There's no.
but
You should not involve any other team. I think I'm fine. I can leave now.
no, I can assure you, it's just few minutes with it will be helpful to you.
But doctor, why do you think that I'm not a
No,
responsible mother?
no. Just as a pediatrician, it's my duty. My top priority is your child, as it's yours. Top priority too. Means both of us want best of her, and this team is basically there to help you with all the safety measures that should be taken to ensure that these things don't happen in the future. So they'll help you in all aspects. Means we are not here to blame. No one is here to blame. We totally understand how these situations are, but
Doctor,
they'll
but you
help.
are saying now that my house environment might be not safe. That's why I was thinking that how can you say that my house environment not safe? I'm
No,
the
but
responsible
we
mother.
just have to make sure that we don't miss even a slightest thing. That's all. Means they know what many things we don't know about baby safety and how to ensure that they are safe at house. So they'll help at their best. Means even in the ways we don't know, maybe. Okay,
So
so
doctor, what
this
do you want to do with what if I stay? What do you want to do?
means they'll just discuss with you the problems you are facing, why these situations are arising again and again. They will visit your house and see everything is okay and the baby is
So they
safe
want
in
to
that
visit my
environment.
house? Why,
Yeah,
doctor? They can ask me. I can tell them. Why they want to visit my house?
whenever you are comfortable with them, they'll just be there to help you. Means
Okay, doctor. If you say so, then that's fine. If
means
6 minutes, doctor.
this is a protocol and we have to follow, and this is for the best of the child. So
But
it's
doctor, what if I don't want to involve this team?
actually, miss, wherever you go, whichever hospital you visit, we have to involve. Miss, this is a protocol, and miss, neither of us can avoid this. So
But
it's
I
better.
hope, doctor, you are not blaming me.
No one is blaming you. I told you, miss. No, miss, I totally understand this situation you are right now, and then me discussing these things with you. But this is necessary, and that's why I have to bring up in this situation when your doctor is admitted. I have to bring up this topic. But trust me, this is very helpful and this is necessary. Yeah, we have to follow it.
Okay, doctor. If you say so, then it's okay. If it's for my child's safety,
It's
I allow
only for
that
her
to be.
safety. Yeah,
Yes, doctor. You can proceed with that.
yeah. So basically, yeah, she's out of danger. So that's good thing. And then I'll convey this to my consultant. If you want to discuss something with my seniors, miss, I can arrange that meeting
How
too.
long does it take, doctor?
Miss, within 2 weeks,
2 weeks?
one
Okay. What they could go for with the 2 weeks? What they gonna do for 2 weeks?
miss, once the child is stable, we'll discharge her home, and then we'll start with these procedures, which might take some time. But till then, the child will be safe and will discharge her home till then. Before that, whenever she is out of danger.
Okay, doctor. But I have my 2 other children. Who's gonna take care of them? They
Miss,
are at home and
no, she'll be discharged. You'll be good to go home after initial meetings, and then the other formalities and procedures, they will take time. But you'll be free to go home with your child when she is stable.
okay, doctor. Okay. Okay, fine, doctor.
Okay. Any other questions you have to ask me, Miss? You can freely ask.
No, doctor. You were telling me something regarding the safety, and that's I really appreciate it.
Yeah, that is a very good thing to go. Even the team, they'll help you when they visit your home. You can totally discuss it with them. But yeah, we have 2 other kids. Yes, you should consider those.
Okay, doctor. Fine, doctor. Thank you very much, doctor.
You're welcome.
Thank you. That's it, finish?
I have.
Okay. So, how do you feel, Dr. Fatma?
Not very good. I finished early because I did not have much points to express, and then I did not.
You didn't summarize what we have talked so far.
Yes, ma'am. And I did not know the whole protocol of safeguarding, means what time they take and
You know, the safeguarding protocol, whenever you are suspicion, you need to involve the safeguarding team, child protection safeguarding team, your senior consultant. So this is how, and
the timeline.
Timeline, to be honest, I exactly don't know what about the timeline. But the thing is that you can tell them that once we are, we start our procedure and we proceed that the child is safe, the home environment is safe. Every part of that process, you will be, being aware what is happening. So this is the way that, whenever there's a history, it's all the system will trigger, and just to make sure the child is safe and the home is safe. So this is the protocol that we have to follow.
Dr. Asad, can I just quickly chip in to just give a few what Doctor has asked? So about the timeline, what I know is that I think it's not, it's my understanding is I might be wrong, that you cannot say that we'll discharge the child and you will take the child as home, because police and social worker will do their lateral checks. And if we found this is a dodgy family, they might not allow child to leave hospital with children. So timeline really depends on how quickly social worker and police gathers the information around family and if there are any historic concerns. We can't give a timeline. Sometimes it's very quick and nothing is found. They go on the same day, but sometimes
sometimes we have to admit the child to proceed with
yes,
some
yeah. Sometimes they need, yeah.
Yes.
Sometimes for the child's safety, because unless they know the family is safe and the child can return to family, they'll not allow the child to go home with parents.
Yes. And I think there's no specific timeline. It's all depend upon how
yes,
you test.
that's, yeah.
So this is how we used to do the practice when I was doing the practice.
Yeah,
but,
I think we can probably say that we can't tell you exact times and dates, but we'll do it as quickly as possible, isn't it?
Exactly. And but the overall, you both have covered, every part. You were both empathetic and you were acknowledging that, the empathy was there. You were not monotonous, that you are talking in one tone. And so overall, that was a difficult scenario and you both have done it very well. That's good. Anyone else? Anyone else want to? So this is the important scenario. Do practice if no one is coming forward, and so what you can do, you can just stand in front of the mirror. You can do the practice. You can record on your mobile phones. Talk again and again. So make sure that your tone, your empathy. You are not monotonous. These small tips really help while communicating in front of the examiner. Okay. So if you have any question, you can always put on the group. And next time we'll do again another mock for maybe regarding the development. We haven't done any mock for the development. So inshallah, next week we'll do the mock. So anyone is interested, do let me know. Okay.
Ma'am, can I give a feedback to Dr. Fatima?
Yeah, sure. Your good name?
Dr. Nancy. If Fatima is okay with it, I wanted to tell her something.
Yes, please. Yeah.
Yeah, Dr. Fatima, I understand that you're very empathetic and it's appreciated, but in these kind of cases, you should be assertive. You can't be very friendly with them. So you will when the conversation goes, if at all they become defensive, you will need to put your foot down and then tell them, no, we cannot send the child home. Child will be here until the social workers take a call on it. So for that, initially itself, if you are very friendly with them, it will be difficult for you to come out of it. So this
Yes, ma'am.
is one thing you should be a little bit careful in this,
Yes,
especially safeguarding scenarios and with senior, junior, and all. Somewhere you have to draw the line. I am a professional here and not your friend here. That's one thing you should do.
but she
Yeah.
cleared, I think that she cleared to the mother that she needs the admission and we need to do the further testing. That's
And
I
and she has
remember
to
it.
clearly mention that for safeguarding, child will be here until the social workers do an investigation. The child cannot be returned to the child cannot return home. That thing has to
Yeah.
be clearly mentioned in the.
Ma'am, if Miss, as ma'am was saying, if they want to take the child to other hospital, Miss, is that an
No,
option?
even no, we will discuss. Then you should tell them that we will discuss with the social workers, and from there they will take a call on it until
So
they
you
find
need
it
to
safe for the.
you need to talk in a tone like the Dr. Nancy is talking.
I don't know. Actually, I'm from India, so I don't know where to draw the line. Miss, till when I can be strict and when I have to let her
Yes,
go.
one or two smiles, okay, but because you are the advocate for the child here, and so you should expect that they'll become defensive.
Because when you enter in the exam station, na, so you only
Mm.
have 9 minutes. So
Yes, ma'am.
so your tone should be according to what just you got the scenario. If it's regarding the safeguarding, you have to clearly tell them that it's very necessary. We need to admit the child, and we can't, we can't spare that. It's a part of the protocol. So firmly, right? You need to tell them that no, we can't spare that. If you want to leave it, it won't help.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
So
Correct, ma'am.
this
Yes,
is
ma'am.
how, and
Excuse me,
just
ma'am.
follow the tone that Dr. Nancy is doing. Na? Excellent, Dr. Nancy.
Thank you, ma'am.
Excuse me,
No, I
ma'am.
just
I
felt
have a
that she was very
question.
sweet to them.
Yeah, sure.
Hello.
Yeah,
Yeah.
carry on, Dr. Fatma. You have question?
No, ma'am.
I'm Dr. Ghazala, ma'am. I have a question. Like,
Yeah.
is there any protocol of discharge against medical advice or leave against medical advice? What we do
So,
in India? Or
So, as Dr. Sarish has mentioned, Dr. Ghazala, that there's no time frame, right? So once we have start with all the, the investigation, if you are suspecting any bruise, obviously you'll go for the blood test, and sometime we need the X-ray if the child is less than 1 year old. So you need to completely explain them to the parents that, whatever the name of the mother, that look, we are suspecting the child might have some injuries that seems not to be accidental. So we want to proceed with a certain protocol. We need to do some certain investigations, and we need to make sure that the home environment is safe for the child. For that reason, we need to involve a safeguarding team. We need to involve a child protection team, because the safety of a child is a priority for you. If your child is safe, you want also the safety of the child, and for us the safety of the child, we also want the safety of the child. So as we are both are on same page, so we need to proceed with the certain investigations and the certain protocols. And this is not that we are the only hospital, this is the whole NHS. If you go anywhere, they will proceed with the same thing. So there's no pointing of wasting time that you want to go to the another hospital. And so you need to firmly tell them that this is the protocol, and the safety of the child is our priority, and let us do our work. And hopefully, once we are done, we'll just tell you regarding each and every. Is that clear?
okay, ma'am. But we cannot do the demo or DOR kind of thing over there. We have
In the
to
9 minutes,
calm the.
what examiner is judging you about your professionalism, your tone, you are not doing your tone, your flow of the communication, and you can, answer each and every concern of the mother. The role player today I've made is a very nice and polite role player. But sometimes the role players are very much stubborn, and they say, no, we just don't. Sometimes they, at the end, they just say, we want to leave. We don't want to stay. And no, doctor, no. So in that case, what you can do, you can just say, okay, I can involve my senior, I can involve my consultant, you can talk to them. At any point, if you feel that you cannot able to handle that, because you are a ST3, you are supposed to be a, you are not consultant at that, So at any point, if you think that you cannot be able to handle, you can enroll your senior consultant and just ask them, then, he will be able to explain you more if you have any concern. This is how we can, this is safely we can save ourselves from that,
At every point of time, we have to be calm. Rather than patient is becoming aggressive or reluctant or want to leave, we have to keep our pace low and calm down at
Yes,
every
you
time.
just have to, I told you, na, we keep doing, when I was doing the practice, we are always, the role player were very stubborn. In my exam, she was so polite. She was just listening. Okay, doctor, if you say so, if you think that, my child needs some, whatever you feel that it's okay, I'll go with you, whatever you are saying. So it was it seems, difficult scenario, but the role play was so sweet that we haven't got any difficulty in proceeding with this scenario. So I wish you all that you all must get the role play that I got in my exam. So that would be the easiest station when you will appear in the exam.
Thank you, ma'am.
May I
Thank you
just
so
may I
much.
just may I just speak a bit? Yeah, actually, what Dr. Ghazala is saying, I am also from India, so
Okay.
we get a lot of such cases. So the thing is that when the patient wants to go, what she actually wants, the point, what I understood from here is that Dr. Ghazala wants here that we tell the patient that, okay, you have every right to go to another hospital, but our hospital will not send you. You will be going against medical advice. So that's what exactly it is, what she wants to ask here. But the thing here is that this is an exam scenario, and we are not being judged on the thing that whether the patient wants to go lama or not. We are being judged here that how meticulously we are making sure that the patient is safe here, the safeguarding
Exactly,
thing.
doctor. Your good name, doctor?
Dr. Rizwan.
Dr. Rizwan. Exactly, Dr.
Yes.
Rizwan. The examiner is just seeing that how you are tackling the case. He's
Exactly,
not
because
saying that.
he has a set of things which he's going to take. So that the tick mark he's going to make here is that this doctor actually made sure that he's a safe doctor, and he is very concerned about the safety of the child.
Exactly. The way the Dr. Nancy said that sometimes we need to be, our tone should be firm, that they don't consider as a very friendly doctor and they will overcome it from us that, no, doctor, we are leaving it. So sometimes you have to make your point clear that, see, Mrs. Fatima, this is really a concern for us. And just to make sure that the child is safe at home, you must be very much concerned for your child. So we do, we are very much concerned for your child as well. The child safety is our priority. So let us do our work, and that is beneficial for your child. We are just doing that your child remains safety at safe at home as well at so let us do our work, and this is how you will explain. And when you enter in the exam, 9 minutes pass so quickly.
Yeah.
So, the examiner will not be commenting that how you, you are firm or not. He is more interested that did you explain your point to the
Exactly.
role player that you are a safe doctor? Are you concerned about the child's safety? Why you are, involving the child? So this is all the examiner wants to know. So
Yes,
I'm
yes, yes.
sure you all are, very much designed doctor. You know your work. You have, passed the AKP, and so this is just a part of a, practice. Do the practice again and again, and definitely you will all be, get 6 out of 6 in no. I think it's a 8 marks scenario.
8 out of 8.
Communication is a 8 out of 8, right? So hopefully you will get the full marks in the communication.
Inshallah.
You just have to prove that you are a safe doctor. Is that okay? Okay,
Thanks a
so
lot.
I
Thanks a
think,
lot.
okay, welcome, Dr. Izwan. So today we have done the scenario, and next time, inshallah, we'll do the developmental station. If you people have any query, concern, you can always text me on the WhatsApp group. Okay, doctor. I'm signing out now. Take
Thank you,
care.
ma'am.
Okay,
Thank
welcome.
you, ma'am.
Love this, love this.
Of course.